Hello, I'm Dr. Yu. Today I'm here to discuss a very important station, that is electroconvulsive therapy. It's very important in FCP's part 2 talks and also in the IM talks. So for this you should know the electroconvulsive therapy is from the physical treatment, and this station is related to explanation and discussion. The construct of this station, you should know about the talks, how to proceed with this station, and you should be ready to answer the question from the patient or the question from the examiner. See, so the good construct for this station include an introduction and repo, explaining ECT, a brief explanation, explaining the indication of ECT, especially focusing on the patient's condition, or you can inform the patient about other indication as well. Then you have to tell about the mechanism of action, the efficacy, the procedure of the ECT, that we know that the before ECT we do certain investigation, we take the anesthetist wetness, and thereafter the procedure during the ECT and the procedure during the recovery. The duration of the treatment and the side effects. At the end, you ask the patient for consent, or you either offer the patient take your time to decide. And before concluding, you have to address the patient concern at present and offer some leaflet to read further. So for introduction and repo, you should start with your names, that I'm Dr. Yu. I'm a psychiatrist working here. I've been told to inform you about a special treatment. So in next couple of minutes, I would be discussing with you about this special treatment which is called electroconvulsive therapy and addressing your concern. Is that okay? Thereafter, you have to explain a brief explanation about the electroconvulsive therapy. It's a form of a special treatment which is effective in many psychiatric illnesses. This treatment is given under general anesthesia, where a small amount of electric current is passed across the brain. This treatment is very effective in certain conditions like certain cases of depression, certain cases of schizophrenia, and certain cases of mania or bipolar. But this is a treatment which is not the first line, but it is actually indicated when certain criteria meet, like when there's a threat to patient's life, or when there's a threat to someone else's life, or when there's some side effect concerns, like we can use the ECT in postpartum period, uh, there are certain indications. Thereafter, you can explain the mechanism action of the ECT. So we know that the exact mechanism action of the ECT is unknown, but evidence show that the electroconvulsive therapy, the electric current which is passed across the certain brain areas, actually target the specific area of the brain, and it improves the chemical imbalance, like increasing the level of certain neurotransmitters, serotonin, noradrenaline, certain hormones, endorphin, and capelin also improve. The neurotropic factor, that is the BDNF, also improve, and also the transmission of neurotransmitter enhances in the brain. So this in turn lead to the improvement of the patient's symptom. As we talk about the efficacy, this is a very effective treatment. It's more effective as compared to psychotropic medication. The efficacy is 80%. That means out of 10, every 8 patients respond to this treatment. Then you have to tell about the procedure of the ECT, and there are three important part of the procedure. The investigation we do before the ECT, the witness from the anesthetist, the procedure before ECT, including the overnight fasting, the checking for the consent, the procedure during the ECT and recovery. These are the important aspects you should know. The duration of the treatment, this treatment is usually offered twice a week and 6 to 12 sessions are given normally. While talking about the side effect, you can say that as every treatment comes with some side effect, but it is not necessary that everyone can get those side effects. So with this, there are some side effects, minor side effects related to ECT, like after electroconvulsive therapy, patient can experience confusion, drowsiness, or some memory disturbance, headache, or muscular pain. But there's no serious side effect and there is no long-term complication related to ECT, other than those which occur immediately after the electroconvulsive therapy, which lasts for a few days, the GI upset or the muscular pain and the memory disturbances. Then you have to ask the patient for the consent. If the patient is not willing for consent, you can ask the patient to discuss with your family member and decide. And you can offer the patient to some leaflet to read through. If there's any concern from the patient, you should address that. I hope this basic understanding how to proceed with the electroconvulsive therapy station is useful. If there's any question, kindly let me know.